Welcome everyone to the IDEA Speaker Series, this webinar. And my name is Francis Fong. I'm the engagement lead for IDEA, and I'm also a manager with the Skill Development and Employment team at March Times Canada, which is a national charity that provides supports to people with disabilities. So before we begin, a quick reminder that this session is being recorded, and the recording will be made available on our IDEA website. French interpretation is also available for this session. So for those of you who may not know much about IDEA, it is a social innovation laboratory focused on helping create stronger and more diverse labor markets that include persons with disabilities through knowledge to practice. IDEA is an acronym for Inclusive Design for Employment Access. Before we start with the webinar, and for me to introduce our speakers for the day, I'd like to share a land acknowledgement relevant to the IDEA National Office in Toronto. The National Office of the IDEA Social Innovation Laboratory is situated and has for thousands of years been the traditional land of the Huron-Wendat, the Seneca, and most recently, the Mississaugas of the Credit. Today, this land is still home to many Indigenous people from across Turtle Island, and we are grateful to have the opportunity to conduct our work on it. This acknowledgement is relevant to Toronto, and since we are gathered here virtually, we suggest that you think of the communities in your respective locations as well. This webinar series serves as an opportunity to hear the latest about current topics in the work disabilities policy arena and learn about activities underway within and beyond IDEA. During today's session, the last 10 to about 20 minutes of this webinar will hold a question and answer period. You can type your questions in the Q&A box at any time throughout the presentation, and we'll answer as many questions as we can at the end of the webinar. Our speakers for today are Dr. Tammy Bernatsky, Assistant Professor of Political Science at Cape Breton University, and Dr. Firat Sayin, Associate Professor of Management at St. Mary's University. Dr. Bernatsky has a PhD in Critical Disability Studies from York University, and using an intersectional approach, her research is focused on understanding the impacts of oppression and developing pathways to empowerment. She specializes in addressing gender-based violence in disability community. My apology. Dr. Sain's research focuses on workplace diversity, employment inequities, and occupational health and safety from a multi-level perspective. He explores the complex relationships between well-being and employment outcomes of workers with multiple identities at the societal, organizational, and individual levels. Thank you for joining us today, Dr. Bernatsky and Dr. Sain. I'll turn it over to you now.
Thank you very much, Francis, for the introduction. Hi, everyone. My name is Frat. Thank you so much for joining us today. Today, Tammy and I are here to share our ongoing research titled Employment Supports and Best Practices for Hiring Immigrants with Disabilities. And first, I will provide some background to our project, and then I will pass it on to Tammy, and she will be talking about some findings and recommendations based on our current findings. So about our project, this project has been initiated as a seed grant from IDEA, and we have been partnering with different community organizations, but our main partner has been Immigrant Services Association of Nova Scotia. It's for short ISANS. So to understand to get a more holistic perspective on the employment issues of immigrants with disabilities, we decided to take a multi-stakeholder perspective, where we have been interviewing and recently holding focus groups with immigrants with disabilities. But we have also been talking to service providers and employers. When it comes to service employers, of course, we have been talking to service employers who have been working with immigrants, as well as service providers who have been specialized in working with people with disabilities. And of course, we have been also talking to employers. Uh, this is really making us keeping us on track to have a perspective from different stakeholders, so we can understand the situation better and we can provide more sound recommendations. In short, we are really exploring barriers and facilitators to inclusive employment. If you could, yeah, thanks, Tammy. So why are we doing this research? To be clear, this research is based on the seed grant, as I mentioned. So we decided to just start with a smaller scope. So we are really focusing on the Nova Scotian context for now. Nova Scotia has the highest rate of disability in Canada currently, with over 39% of Nova Scotians having at least one disability. On top of that, we also have a growing immigrant population. As you can see from the figure, even only between April 1st, 2023 and March 31st, 2024, more than 11,000 immigrants arrived in Nova Scotia. So that's even with that 1 year frame, that's more than 1% of the population. That is, of course, getting on top of all the other immigrants that currently reside in Nova Scotia. And we felt like there's a gap in research on the employment experiences of these groups. Thank you. Now, as I indicated, this research is about the employment and employment support and best practices for hiring immigrants with disabilities. So let me start with why employment matters, because obviously we could be looking at it at different perspectives, but employment, we believe, is a very important aspect of this issue. As I believe we would all agree, work is important because it means income. It gives us that independence. It gives us belonging because we derive an important part of our identity from our work. And in a related sense, it also gives us purpose and dignity. So work, of course, means quite a bit. It means a lot to us. When it comes to immigrants or newcomers, it's of course also a primary route to social and economic integration. Social integration in that it helps us to socialize, get to know people, increase that sense of belonging and purpose. But as I think it's obvious that it's also quite important for economic integration, as it also helps us to gain income and be independent financially. On top of that, we also know that inclusive labor market access is key to achieving the Accessible Canada Act's 2040 goal. But despite these facts, we believe that newcomers with disabilities, but also immigrants with disabilities in general, might be facing poorer employment outcomes. If we could move to the next slide. Thanks, Tammy. So right now, we are looking at 3 different figures, but let me give you a bit of background. So when we are comparing, for example, immigrants, we would, I think it's quite straightforward that we would compare them with non-immigrants or those born in Canada or Canadian born. So comparing immigrants and Canadian born, good. And when we are, for example, looking at the employment outcomes of people with disabilities, to make more sense of that data, we would compare them with people with no disabilities. But when we are looking at intersectional identities, such as immigrants with disability, if you can think of a by two matrix, we would have 3 reference groups instead of just a single reference group. Namely, we should be comparing ideally immigrants with disabilities to Canadian born with no disabilities, immigrants with no disabilities, and Canadian born with disabilities to have a better sense of where immigrants with disabilities stand. So that's the first thing. The second thing is when we are looking at the employment outcomes of any group, looking at only one single employment outcome could be misleading because employment is, of course, a multifaceted construct. Um, the employment rate is important, how many hours we are allowed to work is important. How much we actually, the level of income the employment income, in other words, we get out of that employment is important. There are so many different ways of looking at it, but we decided to at least look at three different employment-related constructs to get a full picture. Now that we have that background, let me explain what these graphs mean. So on the upper left side, we have the employment rates. So the first bar is for Canadian born with no disabilities, which stand around 85%. The second bar is immigrants with no disabilities, which stand around 81%. The third bar is Canadian born with disabilities, which stand around 68%. And the bar on the on the right would be for immigrants with disabilities, which stand around 65%. So when we look at the employment rate, we see that immigrants with disabilities compared to the rest three groups I just mentioned have the lowest employment rate. Compared to Canadian born with no disabilities, the difference is significantly lower. But even when we compare it with immigrants with no disabilities or Canadian born with disabilities, we see that immigrants with disabilities seem to be experiencing significant disadvantage. Oh, also, let me just add this. So this data comes from Statistics Canada, and the data was collected in 2024. So it's quite recent. So we see that immigrants with disabilities are experiencing the lowest employment rate across these four groups. And it appears that both their immigrant identity and their disabilities could be shaping this. On the lower left, we have the median hourly wage figure. And in a similar manner, we see that immigrants with disabilities have the lowest median hourly wage. Okay, so here we see that immigrants with disabilities have about the same median hourly wage, but Canadian born with disabilities and Canadian born with no disabilities seem to be having a higher median hourly wage. What this tells us is that immigrants with disabilities seem to be still at disadvantage, but the main source of this disadvantage could be because of their immigrant identity. It's also shaped by their disability, but the main issue could be their immigrant identity. On the right hand, we see weekly hours worked on average. On the left hand side, again, we have Canadian born with no disabilities, which have the highest number of hours. Of course, we should just underline that the number of weekly hours are quite really close to each other, but still, we still see that immigrants with disabilities have the lowest hours of weekly hours, okay, which is on par with Canadian born with disabilities, and both Canadian born with disabilities and immigrants with disabilities seem to be having lower weekly hours compared to immigrants with no disabilities. So here, the numbers could be indicating that having disabilities could be leading to lower weekly hours. So to just sum up, regardless of how we look at it, immigrants with disabilities seem to be having significant disadvantage when it comes to employment. Uh, their employment rate or their likelihood of being employed, or how many hours they can actually work per week, or how much they might be getting paid, which might indicate their job quality. So, because after looking at these numbers, it just I hope I was able to convince you that immigrants with disabilities is a group worth examining and studying. I'm saying this for two reasons. Number one, immigrants with disabilities unfortunately receive very little attention from researchers or policymakers. And the second reason is, I don't think the reason is that it's because they are a small group, because even back in 2012, the numbers, Statistics Canada numbers, indicated that even back then, there were more than 500,000 immigrants with disabilities in Canada. So, considering our aging population and the increasing number of immigrants, it's possible that the total number of immigrants with disabilities could be even higher now. So, with their unique, uh, perhaps barriers or disadvantages, or some advantages that needs to be explored, I think immigrants with disabilities gives us a very important and meaningful and interesting idea for research, and doing it especially in Nova Scotia because of having the highest disability rate and the rapidly increasing immigrant numbers just made sense to me and Temi. So, having given that this background, now I would like to pass it on to Temi, who will be talking about our ongoing research, and perhaps also give a little bit about what kind of research we are conducting and where we currently stand. Thanks,
Great.
Temi.
Thank you, Farad. Thank you for that great introduction and background. So I'll just premise this by saying that we're not complete in terms of the study. We're in the midst of it. And even we've done more interviews since we prepared for this presentation. So what we have here is based on a very small sample size. So I just want to be clear that this is not the full set of barriers and recommendations. That will come later, and I'll get to that in just a moment. But what I'm going to do now is talk a little bit about what we've heard from immigrants with disabilities, employers, and service providers. We've been talking to service providers both in the immigrant sector and disability sector, if you want to phrase it that way. And we've been talking to employees as well as employers. So the first thing I'll talk about are some of the barriers that individuals face in terms of their experiences of immigrant and disability status in Nova Scotia as it relates to employment. Not surprisingly, one of the clear things that has come about so far is that there's still a lot of stigma related to disability. Unfortunately, this is still the case, and given that immigrants with disabilities carry with them multiple aspects of identity, this can be an additional barrier as well in terms of, in some contexts, people might not identify as having a disability, but then in Canada, their experience might be considered disability related. There's also, again, this is not surprising, a fear of disclosing disability, particularly if it's invisible. For a number of reasons. It could be related to citizenship status and the fear around losing whatever status they have now because of a disability. So there's a lot of uncertainty about what it means to have a disability. Particularly what we heard so far from both immigrants with disabilities and service providers particularly, is that there's an unfamiliarity with accommodations, accommodation procedures, the fact that that's a right in Canada, and also being unaware of qualifying for supports. So some people might not identify their disability to a service organization or to an employer. For service organizations, they might have access to additional supports for people with disabilities, but the individual might not know that because they don't know that they qualify based on disability. And then what we heard also is that there's still limited employer readiness and resources for hiring. And this could be for a number of reasons. There's already employer strains because of economy, and then resources for hiring additional people generally. But then that interacting with the attitudinal barriers that exist might create a less likelihood that immigrants with disabilities would get hired into jobs in Nova Scotia. Sorry, I'm just trying to move forward here. Seems my screen is frozen. Oh, sorry about that. In terms of identity, we looked at immigrant and disability status. Well, it actually came up from the participants in terms of navigating various systems. As we know, with many policy landscapes, it can be very complex to navigate systems generally. If you're looking at immigrants with disabilities, they're often trying to navigate settlement services, employment services, or perhaps disability supports. And often these are not housed in the same organization. So there might be settlement services at one organization, there might be employment supports within an employer situation itself, and then disability supports might exist somewhere else. There are some organizations in Nova Scotia that are able to address both settlement and disability services at the same time, but it is very complicated for people in terms of identifying those organizations and figuring out where to go for different kinds of situations. Some people talked also about managing immigrant and disability identities. So some people have chosen not to disclose their disability because they don't want it to interact with their immigrant identity as well because of that stigma that we just talked about. So they're worried about having double risk, and even employer perceptions of risk of hiring immigrants with disabilities. And this is complicated because we know that immigrant work permits can be complicated because of changing rules at the federal level, which can make it difficult for employers to trust processes around work permits and things like that. So what we heard so far is that there's a reluctance on behalf of employers to hire immigrants generally because of the changing rules and uncertainty around that. And then there's also that double risk of hiring a person with a disability. So if you put that together, that becomes what we call a double risk. We know as researchers that the risk of hiring people with disabilities is a misconception, and that's what we're working on in this project, is to change that idea that hiring immigrants with disabilities would be a risk in the first place. We don't want that perception to exist. In terms of best practices, one of the goals of this project is to really be able to support employers in becoming confident in hiring immigrants with disabilities, but also supporting service agencies around best practices and tools that might help with supporting immigrants with disabilities around hiring processes. So we've come across in this qualitative study a few really great ideas around best practices in terms of highlighting success stories of hiring immigrants with disabilities. And this could really be public-facing information. So on a website, there could be a section on the website that really highlights the stories of immigrants with disabilities and their successes within employment practices. Certainly within disability studies, I don't think it's a secret that the history of disability has long been erased. So storytelling is really important in terms of highlighting the experiences of people with disabilities generally, so that we know that disability is a good thing. Even when we talked about the percentages earlier, that Nova Scotia has the highest rate of disability, whenever we talk about that, we try to be very clear that we're not saying that as a bad thing. Having disabilities often means that people are very resourceful and also very diverse. So it brings a range of experiences to the employment sector, but also to other sectors as well. So highlighting those success stories of immigrants with disabilities getting hired can do a lot of things. First, it can help employers understand that there's a benefit to hiring immigrants with disabilities, and it can also show immigrants with disabilities who might be struggling that there are success stories out there and that it is possible to have a positive experience if they haven't had one already. And then one of the other things that was highlighted so far has been around building employee confidence in disclosing disability and seeking accommodations, because we know that when people are able to get the accommodations they need, they can be as productive as is possible for them. And so we want to make it comfortable for people to be able to disclose that they have a disability. They don't necessarily have to say what their disability is, but maybe it's just the idea of disclosing that they need accommodations. And then also in terms of subsidy grants. So there's been discussion around the fact that subsidy grants might exist for people with disabilities, but there's some challenges there around having employers access this grant and then keeping the employee on for a longer term. So one of the emerging best practices would be to utilize the subsidy grant, but then combine that with a long-term retention plan so that the person with a disability that's hired under the grant is able to stay with the organization for a longer period of time. I'm just going to go back here for a second to make sure I didn't. Okay. Then we looked at best practices for employers. And again, a number of things are coming out in terms of this area as well. So one of the things was looking at integrating inclusive practices for all employees. The best kinds of employers are the ones that are fully inclusive and have a wide range of inclusive practices, not just for people with disabilities, but for everybody. I think it creates a good model for people feeling comfortable in the workplace and feeling truly included. It also removes the onus or the responsibility from employers to seek employees, to seek accommodations. So often, in terms of getting accommodations in multiple settings, people with disabilities feel a responsibility for seeking it, and that can create some tension for them. So if you have a workplace where inclusive practices are the norm, it becomes it doesn't become an individual situation. It actually becomes, I guess you could say, an organizational culture to have inclusion in all areas of life, whether it's related to disability. We know that there's different kinds of accommodations that can happen, whether it's parenting, disability, religion. There's all kinds of ways to be inclusive in terms of employment and employment situations. And then I guess one of the ways to ensure that that happens is to ensure that accommodations are offered at all stages of the employment process. So this would be from recruitment. So having in your ads all of the accessibility and accommodation procedures that are in place, and that making it clear that the ad is also opened to individuals and immigrants with disabilities. And then also in terms of after the recruitment happens, the interview process is really important. So making sure that accommodations are set up for the interview itself. This could be as simple as having the questions provided ahead of time for employees, to having ASL interpretation or other kinds of interpretation that might be needed. And then, of course, having accommodations within the employment, within the environment as well, once the person is hired. And then it's a good idea for employers, to work with agencies to enhance hiring confidence. So service agencies often work with immigrants with disabilities, and they have experience in supporting them to be productive and to be included in the work environment in a way that's meaningful for them. So it just makes sense that employers would work with those service agencies to build their confidence around hiring. And so service agencies could have a lot of good ideas around that process. And if an employer is able to work with a service agency, they would have access to those success stories, but then also to things like if they need recommendations on how to make things more inclusive. So really just partnering with organizations to ensure that your employment setting is inclusive. So as I said in the beginning, we're probably about halfway through the study right now, maybe a little bit more. There's been some challenges, probably related to the attitudinal barriers that I mentioned in the beginning. Also, we shared our call for participants online, and I know this isn't directly related to the topic, but it is related to the study in that when we shared the study online, we had some challenges with AI. And I'm going to note that for any researchers in the room, that even though this is a qualitative study and it's not specifically, we don't have a survey, we're doing interviews and focus groups. When we put the call out for participants, we got a number of fake emails from people asking to be included in the study, probably dozens, which really interfered with us being able to figure out, okay, who's the real participants here? Who are the real participants, and which ones are AI generated? It's the first time I've come across this in all of the qualitative work that I've done. So I wanted to point that out, that it has created some challenges in terms of sifting through the responses to ensure that we don't miss anybody who wanted to be included in the study. Also, disclosure concerns. The importance of relationships is really highlighted for us in this project, because it's really hard to just call an organization, a cold call to an organization and say, can we work with you? And then have participants show up, because there's still that perceived risk that I talked about in terms of immigrant and disability status. So there's still some disclosure concerns that we're dealing with. And then we also recognize that there's limited capacity within community agencies. With the economy and society the way it is right now, agencies are really doing a lot of work with little resources. And so we recognize that it can be hard in terms of capacity for community organizations. And we, as researchers, have very limited connection to employers who have either hired immigrants with disabilities or who have been thinking about hiring immigrants with disabilities in Nova Scotia. So those are some of the challenges that we faced in terms of the research. Related to the challenges are the successes, though. What we've heard from people who have participated in the study is that this research is needed. A couple of people have asked us what made you want to do this research, and then thanked us for doing the research. And certainly people have recognized that whatever comes out of the study will be helpful for the three groups that we mentioned: immigrants with disabilities, service providers, whether they're settlement services, disability services, or both, and employers. So that's great in and of itself. And then also I want to recognize how essential it is to work with our partner, ISANS, the Immigrant Services Association of Nova Scotia, and other community organizations. It's been really important to build relationships and trust with organizations, because direct recruiting is really important. And also we want people to feel safe in coming forward to participate in the study. And if they're coming through organizations that they have built a trust relationship with, it's been really helpful. Also related to the AI point that I mentioned earlier, because if we just put it out on social media, for example, the risk of not having authentic participants raises. But if we do direct recruiting through organizations, then that's obviously more helpful. And then we were hoping to be able to support organizations, and we want this to be a reciprocal process. So we're not just researching on people. We want to be able to in turn provide toolkits to those groups in terms of best practices and dispelling myths and that sort of thing. So we're really committed to ensuring that it's a two-way process, and that the organizations get out of this project as much as we do as the researchers. And then in terms, I'll just use my last few minutes here to talk about the next steps for our project. I don't know if I mentioned this at the very beginning, but this is a qualitative study. So we're very much focused on the quality of experiences of people. We are nearing the completion of our interviews. We've been able to build those relationships that I just mentioned, and we've been able to recruit more, like I said, since we've put together this presentation. So we're really excited about the partnerships, the community building, and also the participants that have been able to be involved in this study. So I have presented all of this with the recognition that we haven't actually analyzed the interviews yet for formal themes, but this is what we're hearing in the research so far. So the next step will be to analyze, I hate to say analyze the data, but look at the interviews and look for themes around the barriers to inclusive employment for immigrants with disabilities in Nova Scotia, but also the facilitators for success. We'll also, again, develop a set of best practices for employers, immigrants with disabilities, and service organizations. So out of those themes that we develop, that's our goal, is to be able to identify those best practices. So in short, I know that was a very brief summary of what we've done so far, and I don't know if you want to add anything, Farat, to what I've said. You're good? I think that was my last slide. Yes, it was.
Wow. First of all, thank you very much, Dr. Paneski and Dr. Sand, for your presentation. Personally, I'm an immigrant to Canada and coming from a country in Asia where disability inclusion, particularly social inclusion, is much less advanced. I found your presentation very interesting and very informative. So we're going to move into the Q&A session now. And just a reminder for the audience, if you're new to the Zoom platform, there should be a Q&A button on the very bottom of your screen. And if you click on it, you can type in your questions. We have quite a number of questions coming in, and we'll try to answer them as much as we can. And I'm going to apologize ahead of time on behalf of IDEA if we don't get to your question. We will try to make note of it. And if you want to email us your question so that we have a way to respond to you, that will be great. So, I understand that your research has not concluded yet, and you're talking about there's development of best practices, and we have quite a number of questions that are related to that as well. But let me start with this question here. The federal government limits immigration by people with disabilities. How does this policy affect the proportion of immigrants with disabilities? If you have any insights to share with us about that.
Jamie, are you okay with me having a stab at it? Okay. Well, thank you, Margaret. That's a great question. We know that, of course, what you say is not new. Valentina Kapuri has a great book, right? Not Good Enough for Canada, where they discuss how the Canadian immigration policies have limited the intake of immigrants with disabilities. And I don't think it's that this is quite different. We still definitely have the same agenda going on. So I really don't have data on this, and it's, I think, difficult to get data on people who have not arrived here, or who might feel disheartened to even consider immigrating to Canada. But I would say that with our very limited number of participants, the majority of them have invisible disabilities. Right? I'm an immigrant. I also have family members who have gone through the medical process of immigration. And if you have an invisible disability, I don't think it's, I don't think you would have a problem passing the medical test, right? Passing the medical exam should not be an issue. And if you have a visible disability, then you would probably have to disclose it at the time. So in that regard, I think immigrants with disabilities in Canada might be a skewed group. How the type of disability they might be having could be drastically different than Canadian-born, the type of disabilities Canadian-born with disabilities have. So I don't want to speculate further on this, but I would be surprised if this policy doesn't affect the proportion of immigrants with disabilities and what kind of disabilities they have. I don't know if Tammy would like to add to that, but no, okay.
Well, great, thank you. So staying within the Canadian context, a question that we have coming in is about the Statistics Canada study showing the respondents from their survey regarding having a disability. And it appears that the more recent study has continued to have that increase a percentage of people with disabilities. So what do you think can help Statistics Canada to get a more accurate number on the report regarding number of people with disabilities in Canada? Because there's certainly reporting issues, and this is kind of tied to the earlier question as well.
This might not be directly related to our study, but I would say that the experience of disability is very different for everybody. In our study, we don't require proof of disability, I guess you could say. Everybody is self-disclosing or self-identifying as a person with a disability, and we very much follow the convention that treats disability as an evolving concept. I think to get more accurate numbers, one way to do that would be to have more publicly facing webinars and things like that around what it means to have a disability, to dispel the myths and the fears that might come with disclosing. So I think that there needs to be more public awareness about the importance of self-identification. You don't have to have a medical diagnosis, because we know that that creates a barrier for people in and of itself in terms of having a disability. So I think making it clear to people that you can self-identify as having a disability without having the required documentation to quote unquote prove the disability, and I think that would make a big difference. Again, not directly related to this research, but I think it would certainly around data for Stats Canada. I think it would make a big difference. I don't know if
That
you want
makes
to
a
add
lot of
anything,
sense.
Brad.
Oh yeah. So I have some experience working with Canadian Survey on Disability and some other StatsCan data that includes disability. I think one specific issue that could be addressed here when collecting data and analyzing data on immigrants with disabilities is to understand that disability identity, especially when it comes to self-identifying, has its roots in our cultural background. How each culture defines, I think this also touches the point you were raising earlier, Francis. How we define disability or what we consider a disability really is depending on our cultural background, which country we are raised, right? So when you send these questionnaires to people from different backgrounds, some of them might read the questionnaire, but perhaps they wouldn't even consider them having a disability. I'll just give a quick example. One of our participants, for example, told us that they knew that they had ADHD, that that limited them considerably in their task of or in their let's say pursuit of finding employment, but they did not think about it as a disability until moving to Canada. Now they consider it a disability. That participant told us that, oh, I didn't really think of it as a disability, but after coming here and after looking at it from a different perspective, I actually understand that that could be limiting me, and then I started considering it as a disability. So the cultural component of it is important. Another point I could mention very briefly is Statistics Canada, as far as I know, is using social model of disability when defining disability. This has its advantages, but also some advantages, considering some other models of disability for a more inclusive representation of people with disabilities with other social identities might also be useful.
See. We're going to shift the focus to more on the support side now. So a question we have is that the support is different in different provinces and territories across Canada in terms of availability and service delivery as well. So do you find that it makes a barrier for newcomers that wants to disclose the disability as well?
Temi, do you want to start? Then I can just follow.
So we haven't compared provinces. We know that supports are, I could have a very long conversation about how much I think disability supports are lacking across the country. We haven't discussed it a whole lot in the interviews, at least the ones that I've been a part of. So maybe Farah can add to this. But I do think that there's an unawareness of what supports are available. And also there's I would say, barriers related to qualifying for those services, right? Because a lot of services you have to have medical documentation, and that can create barriers for people who don't have access to healthcare in equal ways as others, right? And so I think there's already barriers there in terms of qualifying for disability supports. And I think across the country, we can say that disability supports are not adequate. I do think it does create a barrier, but we haven't directly discussed it in this study. Farad, do you want to add to that?
Well, if we are specifically talking about support agencies, not only support as an institution, one idea we have been thinking about, it's very, again, early development, it's early development, is that when we are talking about employment of immigrants with disabilities, we are talking about support for immigrants or newcomers. We are talking about support for people with disabilities, and we are talking about support for employment. In many agencies, these could be basically different pathways. It could be under different departments. There could be different case managers looking into these. In many cases, organizations could be even different. One support agency could be specializing on people with disability, another on, let's say, immigrants, right? So the intersectional nature of the immigrants with disabilities shows us that what's intersecting is not only the identity, right? How the society thinks of immigrants with disabilities, and how the policies and how the support is organized is also related to this intersection. So when we are thinking of intersections, we should, of course, be specifically in our case, looking at a specific personal group of people, but that intersection starts with that person, but keeps going all over the multi-layered nature of our society. Stuff, for example, if they're employed or if they're on the job market, you can just start with the individual and then family and then community and then their, let's say, workplace and then the labor market and then the policies. So I think it's important to this example of some recommendation of support agencies is also can be adapted as a wider best recommendation for different stakeholders. And we are also hoping to provide some suggestions to different stakeholders. But again, we are still in early phases of our research. So this is really some early ideas that we are sharing now.
Yeah, thank you. I think you really highlighted the sort of the importance of the intersectionality, the understanding, and how it impacted supports and employment in general. So speaking of health earlier, one of the questions we have here is that health is often or sometimes recognized as one of the social determinants. Employment is it's identified as one of the social determinants of health. So in your study, have you looked into the impacts of health outcomes and quality of life at all?
I agree that employment and income generally is I would argue, the number one social determinant of health because it's connected to all of the others so strongly. I'm very passionate about quality of life and measuring that. It hasn't come up in this study. That's not to say that we won't have that lens when we're looking at the interviews and what people have told us. We haven't asked, I guess, to put this another way, we haven't asked questions directly related to health outcomes, but that doesn't mean we won't find it in the interviews once we go through them. But I very much take your point that it is really important to consider the implications. And one of the reasons we wanted to do this in the first place is because employment and income is so important for people's quality of life. Yeah.
Sure. Okay. We're going to hone into something more specific as well. With the neurodivergent immigrants, they may face communication and more cultural barriers when they needed to explain their needs as well. Did your research identify any ways that employers can maybe better understand that and supports these intersecting challenges?
It's an interesting question. We definitely had a few participants who are neurodivergent immigrants, but we haven't really looked at what this specific group uh, needs or how employers look at the specific group. That's something we will definitely look at based on our data. But so far, there isn't something that I can tell you right away. It would be too speculative, but that's a great question. This is very important, especially as I mentioned, most immigrants with disabilities could be having invisible disabilities, which may include at least some of the neurodivergent immigrants. So I would be surprised if this doesn't come up as one of the findings. And this is also, I think, a great question for a future study. But we'll see what we find. We will definitely be touching on this. Great question. Thank you.
All right, I see. What about locally now in Nova Scotia? Have you noticed any gender differences among employment with immigrants with disabilities, and are there any specific agencies that you're aware of that maybe have the expertise to serve immigrants and people with disabilities together?
Right, great question. So, if Temi, if that's okay with you, if you could share the very last slide from our deck, where I can talk a little bit about the gender differences, and then maybe we can talk a little bit about the second question, service agencies. So just to be clear, the figures that you are going to see now is not specific to Nova Scotia. This is basically a Canada-wide data. We just wanted to include this in case anyone asks about some other social identities, including sex or gender, which is very, very important. I also wanted to include this to basically make sure that we are all on the same page about immigrant and disability identities are very, very important. But we all have also some other social identities. So again, we have the same three figures from the earlier slide. On the upper left hand, we have the employment rate. Lower left, we have the median hourly wage, and on the right side, we have weekly hours. So these three bars in each graph only include immigrants with disabilities. On the left bar, we have the immigrants with disabilities. In the middle bar, we have the female immigrants with disabilities. And on the right bar, we have the male immigrants with disabilities. Without going too much into detail, as you might see, male immigrants with disabilities have a higher employment rate. They have a higher median hourly wage, and they work more hours in general. So there's a very clear gender effect here, right? Male immigrants with disabilities have a clear advantage when it comes to employment over female immigrants with disabilities. Again, this is a Canada-wide data, so I don't have any specifics for Nova Scotia. This is just to give some background, but it is definitely, I think, sex and gender and other social identities like class or visible minority, ethnicity, sexual orientation, which are some of the social identities that we are touching on our research with our participants as well. Again, in line with the intersectionality idea, they all come together. And when we are trying to understand someone's unique experiences, their unique advantages, disadvantages, the barriers they face, we need to be looking at from a more holistic perspective. So I think this figure is a clear indicator of that. There was the other question. I don't want to take it too much because we have limited time, and maybe Temi can also answer the second question. Was it about the service agencies in Nova Scotia and whether they provide service to immigrants and people with disabilities?
Yes, it was asking whether or not there's organizations that support both, that support specifically immigrants with disabilities. I think what's coming to mind for me is that there are organizations that might support, for example, people with disabilities in employment, but because of the increase in the number of immigrants that have moved to Nova Scotia, more and more of the population that they serve are immigrants with disabilities. It could be the case vice versa. I'm just not sure on that, but that's what's coming to mind with that question.
Great. So we're almost out of time. So I'm going to give you an opportunity to and offered perhaps maybe one last things that you could maybe give us. So IDEA is most interested in building capacity in the workplaces for people with disabilities. So if you can offer like one strategy, I know you're still developing sort of best practices, but if you can offer one strategy related to how we can maybe build confidence for immigrants with disabilities, or offering to employers how they can integrate some of the things that you said. What would be the one thing that you can say now?
Let me start, if that's okay, Tammy. So just one thing, we have limited time. So this was something that also came up during the focus group we were holding yesterday. I would say inclusive recruitment and onboarding practices. That seems to be a really huge deal among immigrants with disabilities. I think immigrants with disabilities, if we were to look at it strictly from a business perspective, making a business case, they are a huge untapped group. They are very talented. They have unique experiences and unique strengths, right? Because you could be looking at them as having double disadvantages, right? But with all disadvantage also comes an advantage. They have unique strengths, unique value propositions that they could bring and really benefit employers. The first step of that is actually having them considered and letting them into the organization, right? That's why I think inclusive recruitment and onboarding practices are important, because immigrants are facing unique challenges when it's come to that. Even using a non-English or non-French first name or surname could be an issue, as research indicates. But people with disabilities also experience unique issues, unique barriers as well. And immigrants with disabilities could be facing double barriers in that regard. So I would say, I would recommend, if I had to suggest one recommendation at this point, I would say inclusive practices related to recruitment and onboarding.
I think we're at time, but I would just quickly add that highlighting the success stories is really important. And then also, if employers are struggling with their confidence, they should reach out to settlement and disability organizations that have experience in this area who can support them.
Well, thank you very much, Dr. Bruneski and Dr. Sanj, for very thoughtful responses for these questions as well. So for the audience, a reminder that a recording of this session will be available on our IDEA website, so please stay tuned. We are going to be taking a break from the webinar series during the holiday season. So in the meantime, though, do reach out to us if you have any questions or any suggestions for future topics. You can email us at info@varet-idea.ca. And I hope you enjoyed today's session, and thanks everyone for spending time with us. I also wanted to give a quick shout out and thank you to our Michelle, our French interpreter as well. And happy holidays to everyone. Thank you for joining us today. Bye.